One of the hardest things to do in IVF is making the right decisions. Now, you might wonder why. After all, IVF is a standard medical treatment. You're going to an IVF specialist. He's an expert. He's a professional. He's done thousands of IVF cycles. So it's very easy for him to analyze your medical records, do the tests, go through your history and tell you what to do. So what's the big deal? And the reality is making decisions is not that simple, because making decisions isn't just a question of the doctor deciding for you, and isn't just a question of looking at records and using your head to make these decisions. It also involves your heart and your gut. And these are decisions which finally need to be made by patients. The patient needs to take ownership. And this is why sometimes it can be so confusing and so complex. Now, in a straightforward, simple world, you would let the doctor make all the decisions. After all, the doctor is the expert. That's what you're paying him all the fees for. He's been doing this for so many years. He's seen so many patients. He has so much experience, expertise. He tells you what to do. You do it and you get pregnant. Perfect. Happy ending. Unfortunately, IVF doesn't have a 100% success rate. And that's the fact of the matter. And a good doctor will share this information with you up front. Now, a lot of patients want a doctor who will decide for them. And most doctors in India are very happy to do this. We are taught to have a very paternalistic approach. The doctor is the expert. Here's the patient. The doctor is on a pedestal. It's the patient's job to listen to whatever the doctor says. Patients shouldn't ask too many questions. So what do they understand anyway? And just because they've gone on Dr. Google doesn't mean anything. A doctor has so many years of training and so many years of experience, and the patient should keep quiet and just tell what the doctor tells them to do and listen to the doctor. And if they listen to the doctor, then everything will be fine and they'll get pregnant. I wish that were true. It would make everyone's life so much easier, but the reality isn't. Which means no matter what, the fact of the matter is IVF cycles are riddled with failure. And that's why decision making is so important. You need to understand the facts first. It's not enough just for the doctor to understand the facts. You need to understand it because you're the patient. It's your life. And the good news is it's easy to understand these facts. We have a website called www.drmalpani.com. We've got over 1,000 pages of information. All of this is authentic, updated, trustworthy because I have written it. So you can trust what you're reading. And it's written for patients, so it's simplified, very basic, lots of videos, nothing which you can't understand. And if you still have more questions, hey, just go to our website and send me an email and I'll answer whatever questions you have. So that's the good news. Figuring out the facts is relatively straightforward for patients. But that's not enough, because even after you've processed the facts, you still need to listen to your feelings. What does your heart say? What does your gut say? So the facts could say, hey, look, I'm sorry, you're 39. Your chance of getting pregnant with your own eggs is very poor because your antral follicle count is poor, your AMH level is poor, and your chance of getting pregnant if you use donor eggs is much higher. Those are the facts. Easy enough. But it's not easy for a patient to accept the fact that they need to use donor eggs. She'd much rather perpetuate her own DNA and see her own face in her baby's eyes. So of course she wants to try with her own eggs. So if the chance of her getting pregnant with her own eggs is 5% and the chance of getting pregnant with donor eggs is 50%, who's to make the right decision? What is the right decision? Is it better to do something which maximizes your chance of getting pregnant quickly? Or is it better to do something which transmits your own DNA? And how can a doctor make these decisions? It's a decision the patient needs to make for herself. And that's the additional level of complexity, because these are not decisions you make in isolation. Infertility always affects a couple. And no matter what the wife thinks, the husband doesn't have to necessarily agree, or vice versa, which means the couple has to decide. And especially when it's decisions like adoption or very expensive decisions like IVF, you often need to get the extended family involved, none of which is easy. The good news is that other people have solved these problems, and you can use their experience to do the same thing. As I said, you can use the facts on drmalpani.com to make sure you're well informed. Lots of online bulletin boards and forums for infertile couples. You can ask other people for their advice. You can get a counselor, could be a therapist or a specialized reproductive counselor or a psychologist who could walk you through your options and empower you to make the decision which is right for them. Remember, this is called non-directive counseling. The answer has to come from you, not from the doctor or your mother-in-law or anyone else. And if you own this decision, if you make it for yourself after doing your homework, after listening to your heart and your gut and your soul, you will have peace of mind that you made the right decision for yourself. So no matter what the outcome, at least if you followed the process properly, you will be able to sleep well at night, knowing that you gave it your best shot. And at the end of the day, that's all any human being can do. We're happy to help you make a decision. We will not tell you what to do, but we will tell you the truth, the unvarnished, honest truth. We'll spell out your options, tell you the pros and cons, and then allow you to make the decision. And guess what? That's a free service, no strings attached. And because it's all in black and white, you know it'll be the honest truth. Look forward to seeing you at drmalpani.com, which is www.drmalpani.com, and look forward to helping you to have a baby, because that will give me a lot of joy and satisfaction.